Hi, Dr. Kelly Pearson back again. We're going to talk about disc herniations. You'd think I'd talk about this first when I was talking about back pain, but really, truthfully, it is not, it shouldn't be as prominent as it actually is. Back in the 30s, there were two researchers and physicians who identified that disc herniations could be a great cause of back pain. And we kind of got focused on that too much in my estimation. And we should be asking the question, why do discs get sprained or strained, and what can we do to fix them? And we've been addressing that as we go through these videos. But let me just talk about a few progressions here, and you have a PDF below that you can follow through. So here's 3 vertebrae coming from the low back, the lumbar spine, and these are healthy discs, and they are holding the vertebra apart, and they're creating a nice space for this hole, what we call the intervertebral foramen meaning hole. And this is a happy disc. There's no swelling, there's no bulging. What happens with discs sometimes is you get an MRI and it'll say diffuse bulging disc. Really, that means that disc is aging a little bit, that it's starting to bulge at the periphery, but it really has nothing to do with your pain. It's saying that the process of degeneration, thinning of that disc is likely happening, but a diffuse centrally positioned bulging disc is not something that we worry about in terms of causing your pain. It tells us that we need to have you get a healthier spine and exercise and stretch. Then after diffuse bulging disc, what happens is we get herniated discs. And what a herniated disc is, you will see that the inside of the disc, the nucleus, breaks through the annular fibers, the outer rim of protective connective tissue, and that protrusion actually pops through the annular fibrosis, or pushes it. Maybe it doesn't pop through completely, but pushes it, so now it's protruding out onto a nerve. And in this particular model, you can see when I put compressive pressure on the disc that there is a little, I'm going to move these nerve roots out of the way, there's a little tiny disc protrusion that sticks out, and that is because the annular fibrosis, the outer portion of the disc, is actually a bit torn. And yet these tissues do often heal by taking care of the stress and the rest of the spine. Periodically, however, what happens is that the protrusion is so significant that it's a big protrusion, and it really puts a lot of pressure on the nerve, which travels down the leg, and you're getting a lot of lancinating leg pain. Now, plenty of times people go on without surgery to fix those problems, but every once in a while what will happen is that little portion that's sticking out, it actually gets pinched off. And now we call that a sequestered disc. And those are very, very difficult. In fact, most of the time they'll pinch off and put pressure on a disc, and no matter what position you get in, you can't get that leg pain to go away. Now, there has been some very good studies that show if you can withstand the pain for 6 to 8 weeks, oftentimes that sequestered piece reabsorbs back, but sometimes you just need surgery to pull it out. So we have all kinds of surgeries, and we'll talk about those in an upcoming video. But disc herniations go from a healthy disc to bulges, to protrusions, herniations, and to sequestrations, and it depends upon where you are in that spectrum how quickly you can recover and heal. It generally does not require surgery, and mechanical therapies can be of tremendous benefit. Not to say that we assume all of these things are going to heal on their own. We watch and progress and make sure you in fact are healing. But the vast majority of people do recover when they're doing the right things around disc challenges. So I hope that was helpful. Thank you.